Welcome. In this presentation, we'll be taking a closer look at the Patient Health Questionnaire 15, also known as the PHQ-15. This tool was developed by DR's Robert Spitzer, Janet Williams, Kurt Kroenke, and their colleagues, with support from an educational grant from Pfizer Inc. Recognizing the signs of mental health disorders can be challenging, especially when they manifest as physical symptoms. To help with this, a suite of tools known as the Patient Health Questionnaire, or PHQ, was developed. Originating in the mid-1990s from a comprehensive diagnostic tool, the PHQ family offers quick and easy-to-use assessments for healthcare professionals. Today, we're focusing on a specific part of that family, the PHQ-15, which is the Somatic Symptom Scale. Its primary job is to measure the severity of physical symptoms and help screen for the potential presence of conditions like somatization and somatoform disorders. So, what exactly is the purpose of the PHQ-15? First, it helps us count the number of somatic or physical symptoms a person is experiencing. But it goes beyond just a simple count. It also helps us understand the severity of those symptoms, how much they are bothering the individual. By combining this information on symptom count and severity, the PHQ-15 serves as a powerful screening tool. It helps clinicians assess the potential presence of somatization and somatoform disorders, where psychological distress manifests through physical complaints. One of the biggest strengths of the PHQ-15 is how practical and easy it is to administer. It's designed for use with adults, specifically individuals aged 18 and over. Crucially, it's a self-administered questionnaire, which means clients can fill it out on their own. This flexibility is a huge advantage. You can even send it to a client online before their session, which helps you come prepared. And to top it off, it's incredibly quick, typically taking less than 5 minutes to complete, making it a highly efficient tool for any practice. Let's take a look at the questionnaire itself. Clients are asked to reflect on the past 4 weeks, which is a longer time frame than the 2 weeks used in other common screeners like the PHQ-9 or GAD-7. The questionnaire consists of 15 items covering common physical symptoms, including 13 core somatic symptoms, plus 2 items related to sleep and fatigue. You'll also notice a special instruction for item number 4, concerning menstrual problems, which applies only to women. For each symptom, the client rates how much they've been bothered on a simple 3-point scale: not bothered at all, bothered a little, or bothered a lot. This differs from the PHQ-9 and GAD-7, which use a 4-point Likert scale ranging from not at all to nearly every day. Scoring the PHQ-15 is straightforward. Each response is assigned a numerical value: 0-4, not bothered at all, 1-4, bothered a little, and 2-4, bothered a lot. These scores are simply added up to get a total score, which can range from 0 to 30. It's important to remember that for respondents who are not women, item 4 is scored as a 0. This total score then falls into one of 4 severity levels: minimal, low, medium, or high. Think of these cutoffs as a warning system. A score of 10 or more is a yellow flag, drawing your attention to a potentially significant issue, while a score of 15 or higher is a red flag, suggesting that active treatment may be warranted. Like any tool, the PHQ-15 has its limitations, and it's crucial to understand them. First and foremost, it is a screening tool, not a diagnostic one. Its biggest limitation is that it cannot distinguish between medically explained and unexplained symptoms on its own. For example, a high score for headaches doesn't tell us if it's from a migraine disorder or from stress. That requires a clinical interview and judgment. Therefore, it's best characterized as a measure of somatic symptom severity to guide further inquiry. Regarding its use for monitoring treatment, there's preliminary evidence that it may be responsive to change, but it's an area that requires more research. After reviewing the PHQ-15 score, the clinical investigation really begins. This is where you'll want to explore the context behind the symptoms. For instance, have the current symptoms been triggered by any recent psychosocial stressors, like a job loss or relationship issues? You'll also want to understand the timeline. What is the duration of the disturbance? And to what extent is it impairing the person's usual work and activities? Looking back, it's helpful to ask if there is a history of similar episodes, and if so, how they were treated. And finally, exploring the family history can provide valuable clues about potential predispositions to similar conditions. Now, managing this entire assessment process can be made much simpler with a tool like PsyPack. It streamlines the workflow into 3 easy steps. First, you initiate the assessment, where you can easily email the PHQ-15 directly to your client. You can even set it to repeat automatically at fixed intervals, like every 4 weeks, to track progress over time. Second, the client completes the assessment online through a simple, user-friendly interface. And third, as soon as they're done, you instantly get the report, complete with scores and visualizations, ready for your session. Let's take a closer look at the kind of report PsyPack generates. The system handles all the scoring automatically, providing an interpretive report that saves you from manual calculations. You get a detailed response sheet with a color-coded graph, allowing you to see the client's score on each individual item and quickly spot the most pressing symptoms. The report also provides the total score and corresponding severity level, neatly plotted on a color-coded graph for clear, visual interpretation. This means you can spend less time on paperwork and more time where it truly matters, with your client. To explore these features and streamline your assessment process, you can create a free account on PsyPack.com. Be sure to follow us to stay ahead with the latest in psychological assessments and tools. Thank you.